I think we're up and running. So let me bring this thing to presentation mode, and we'll get started. So I've got, as you can tell, I got a PowerPoint. This is Larry Spear, and I'm going to walk us through the subject for tonight's Tuesday night training is the power of our discount card. And just to kind of let you know who I am, this is Larry Spear. I'm the National Sales Director, and I'm here to help you the best I can. There's my email address. If I've talked to and emailed many of you so far, but if I can help you in some way, if you have any questions, just drop me an email. If you'd like to schedule a time to talk with me, you can go over to www.lmspirit.youcanbook.me, which is hard to say, but you can schedule a time that's convenient for you and for me, and then please remember to leave a phone number, contact number for me so I can get a hold of you. So here's what I want to do tonight. Our agent force tends to get split between folks who are insurance agents and folks who have joined the company with the discount card program, because it's a great opportunity. So I want to make sure that we just kind of have a good chat tonight about the discount card, how it works, how it doesn't work, how we're completely different than all the other ones that you may see in the marketplace. I'm going to try to encourage you a little bit to, if you haven't ordered your cards, get your cards ordered. If you've ordered your cards and they're sitting in your office, get out and hand them out. And I think that spending a little bit of time together tonight and let me walk you through some of these, some of the highlights of what we do, and so that you understand the power of what this program can do for you. So anyway, let's get started. Just kind of a couple of things I found the other day that I thought you might like to see. Is that there is just a huge need in America today, even with the promises of health care reform and ACA or Obamacare, whatever you choose to call it. The truth is that there's more people with health insurance, but unfortunately for many millions of folks who bought the Obamacare plans, they still don't have much prescription coverage, and there's still many millions of Americans who don't have any coverage at all. So a good discount card program really works well for them. 45%, the statistics say 45% of Americans who struggle, there are 45% of Americans struggle paying for their prescriptions, and the staggering number is there's 26% of Americans say they've had a prescription written and didn't get it filled. A couple of trainings ago, I suggested go to your drugstore, stand around a little bit, and watch people come up to the counter and hand their prescription over to the lady, get a price from the medication, and then get the prescription back and put it in their pocket. That's the problem that we're trying to solve with all of the programs that we have here at Lone Star, and so the discount card is really a good initial tool to help people out. So another little thing for you is that there's a huge need to teach our prospects, to teach our friends and family that you got to shop for your medications. I mean, if you've ever gone into our lookup tool, or if you've ever used anybody's prescription lookup tool, and you punch in the name of the medication and the quantity, and then a zip code, and watch the different prices come up, there's a pretty big spread of pricing, even with the discount cards. And what's interesting is that oftentimes the big chain stores are higher than the local independent stores. So we need to teach them to shop. I use this analogy all the time. Nobody would go out tomorrow to buy a brand new F-150 pickup truck and not have some idea of what it's going to cost them when they go to buy it. but Americans buy health care every day and have no idea of what the costs are. So anyway, you got the idea. So generically, here's how a discount card works. They're free. That they cost the user nothing. That they cost us, the agents, nothing other than the cost to have the cards printed. So how do they work? Well, the way they work is pretty simple. That they are if done correctly, the pharmacies like to have them because they draw people into the store. So the way a traditional discount card works, same way our discount card works, is that they go in, the VIN numbers and the group numbers and the PCN numbers all are tied to a contract that a PBM or a middle person manages. The pharmacy scans those numbers, keys those numbers in, and a price pops up. That price is determined by how the pharmacy has signed an agreement for it, and then the pharmacy can choose to honor the card on a voluntary card like this. They can choose to honor the card or not. So the way this works, and so you understand how ours is different, one of our advantages, the way all of these work is that there's a cost of the medication, there's a dispensing fee, and then there's an administrative fee that the program costs the pharmacy to accept. And so the lower the admin fee, the more apt that the pharmacy is going to accept the free card. You can know that our admin fee, which, by the way, just so you know, that's where your money comes from. Your $1.75 of an adjudicated prescription comes out of the admin fee that's tacked on to the cost of the medication. The way ours operates is that there's an admin fee that's attached. Then out of that admin fee, you get paid, the PBM gets paid, and the pharmacy gets paid. But that's how they work. There are a lot of those cards that you see laying around in truck stops and windows and doctors' offices and all those kind of things because, obviously you guys know by now we're not the only discount card out there. Is that those things, many of them will have an $8, $9, $10, $12 admin fee, and many pharmacies don't like to take those, will refuse to take them. So know that when for the most part, when our discount card is presented at the store, that they are received and they will be run through the system. And if they can save the patient money, that's how it works. So I won't beat that to death, but I wanted you to understand how they work. There are claims that these you get paid, I get paid when I do these, off of what's called an adjudicated claim. That means that the pharmacy scans the card, the patient takes the medication, it goes through the PBM system, and they pay our commissions on what they consider to be an adjudicated claim. That's one who goes through the system. But they just so you know, not every claim that goes through the adjudicated system actually gets commission attached to it, and you need to know that. That's true for every card. Some cards will run 35-40% that don't get paid. Ours run somewhere between 15 and 18% that tend not to get paid, and the reason for that is that if it's a low cost generic, they're not going to be able to pay a admin fee on top of a medication they dispense for $4. But you guys have that makes sense when you think about it. So that's how discount cards work. All those cards you see out and about, some are good, some are not good, not our responsibility, but I want you to understand how we differ. So how we differ is simply this little part that we print down here on the on the bottom, and that is if your RX is more. Hang on just a second. Somebody says they can't see what I'm presenting. Well, hold on a minute. I don't know why that would be. Hang on. All right, hold on. Don't I sound just wonderfully with my nice Southern accent talking to you? Hang on a second. Nope, that didn't work. Okay, I think, can you see me now? Well, whoever told me you've been saying that for 10 minutes, I appreciate that. But unfortunately, I can't see the chat screen and what we're doing. So you'll just have to live with me, I reckon. And this thing's free to you, so it might be worth what you pay for it. Just kidding. So hang on a second. See if we can get back here. All right. So hopefully now we can get back to where we were, and I can minimize this thing. So we good to see? Yep. Thank you for whoever helped the guy get it together. All right. You guys are a tough crowd, but thank you for supporting me. Just kidding. All right. So here's the deal. Here is the absolute value proposition that the Lone Star Script Care discount card is. Here's the secret sauce. Here's the power of the card. It is unique to us, and it is why you should spend a lot of energy and effort in passing out free discount cards. And it's that which is printed down in the bottom right-hand corner of that card, which says, if your RX is more than $20 per month, please call the RX Assistance Hotline and the phone number. Because what that does is that if they go and use that card and it's still more than $20 and they're trying to get some relief from that card or from the prescription price, they call in that number. They will engage in conversation with one of our advocates there in the office and begin a conversation to see if we can help them in some other way. They'll talk to them about the same way they do it when you and I call in a prospect piece of information, that they're going to take them through the triage. They're going to get an idea of what medications they take. They're going to get an idea of how much money they spend. No, somebody said if you hand out 100 cards, will you get or 1,000 cards, will you get 100 customers? No, I don't know where you got that. If I intimated that, the answer is no. But hang on with your questions. Again, I can't see them as we're doing this, and I'll open the chat up at the end, and I'll try to answer questions for you. But what happens is that the group number that you guys have, that I can't read it from here, AHLS, and then your agent number. That's the code. That's how you get paid. That's how we track the adjudicated claims for you on the discount card side. But it's also the way the office tracks who comes in from a referral from one of the cards, and it's how you get paid. If you hand this card out and somebody takes it to the drugstore and they adjudicate a prescription, you're going to get paid $1.75. If they take it to the drugstore and it doesn't work, or they want to see if they can do better, and they call that 888 number and they talk to one of our advocates, and we are able to help them either with a PAP plan or with the new RX Select plan, then you get paid the full commission. That's the power of the card. It begins a conversation with a prospect that you'll never probably ever talk to. But it allows us to utilize the effort that you have in passing these cards out every place you go, so that you can get paid to do that. And this is this is what opportunity people call passive income. You go out and it's recurring income. You go out, you spend the energy, you make the investment in the cards, you make the investment in distributing the cards. A certain number of these things will get to the drugstore, pharmacy, will be used to adjudicate claims. You will get money off of those cards. But the real money in it and the real value in it to you as an agent is that which is written in the right-hand corner, where we encourage them to contact Lone Star corporate offices, talk to one of our advocates, let the advocate then guide them into the triage system to find out how we can help them. They'll get them enrolled, and you get paid to do it. So hopefully that kind of gives you an idea of, I hope you can begin to see the real value in what we do. I'll come back to that in just a minute. So here's the deal. Here's your marketing ideas. It's simple. Get as many cards in the hands of as many people as you possibly can. There's all kind of ways to do that, but you know, and I'm going to share a few with you that I think work the best. But this ought to be something you carry with you when you have a conversation with people. Hand them a card. If they don't, you just don't ever know who has a need and who, if they don't have a need, who may pass it on to somebody else who does have a need. But the trick here is you've got to get the cards into the market or they do you no good. Passing out 10 cards and waiting to get waiting to become the next discount card millionaire, it ain't going to happen. And that's just truthful and straightforward. But you get enough of those cards out there in the hands of enough people who have a prescription need and that we can solve, and you'll start to get paid for business you didn't even know you created. It takes lots and lots of cards. Now, I'm going to tell you my own personal story. I'm an insurance agent. Some of you know that. I have an insurance license. I don't do too much of the insurance work anymore. But back 4 or 5 years ago, I got involved with another discount card program, and through one of my senior insurance companies, and it's the same idea that we talk about today. It's a beautiful product. It's to help seniors save some money, help free up some income to be able to pay for the insurance I was trying to sell them. Great idea. I loved it. I bought 5,000 cards. Now, this is probably probably 5 years ago now. I just moved 90, 60, 120 days ago or so. And when I moved, I threw out those 5,000 cards that I had ordered that many years ago. And they did me no good other than take up a big box of space in my office for such a long time. I can't imagine what money I could have made had I just gotten busy and got out and passed the doggone things out. So my encouragement to you is get the cards and get them into the marketplace. So, well, Larry, that's great, but I've been out and about and there's cards everywhere. Well, that's true. But I'm going to give you a couple of places where you just got to go, and I'm going to give you a little bit of hint tonight on how to do it, and then I'm going to give you a little bit of hint as we have these training sessions over time. The healthcare offices, your doctor's offices, your chiropractor's offices, dental offices, if they're in the healthcare business, I'd take, and I have any relationship with them at all, I'd go stop in, go to the front desk, tell them who you are, tell them what you want to do. That they don't care. And some of them may tell you, well, there's already 2 or 3 stacks over there. And your answer to them is, yes, but we have a much more powerful card, and here's why. And you tell them about that printing down on the right-hand corner You tell them that you represent a company that can help the patient when nobody else may be able to help them. You tell them that millions of Americans could qualify for pre-prescription medications if they only knew about it, and you'll engage many of them in a good conversation, and many of them will take your cards and pass them out. And so I would go see, just like all the rest of them. Here's the other trick to that. When you go in and see them, you tell them you'll be back. Because most of the people that came in and left those cards before are gone. They've quit. They're not doing anything. They're just laying around. And you've really got to you got to establish a little bit of a route. It would be my recommendation. So that's healthcare offices. The one that I would go after first is and I didn't know exactly what to call it, so I came up with the disease support groups. The American Diabetes Association is in many towns. The Crohn's Disease Association is in many towns. There's COPD support groups out there. If there's an illness, there will be a group of people in your community that's connected to other people who have a similar disease. And most of these folks, lots and lots and lots of them, have a real struggle paying for their medication. You guys all know the stories of Hep C. Now, it's probably not a great example because those are $92,000 to get a treatment run of Hep C with Harvoni or Sovaldi or whatever. And that's not a great example because we can help them some, but not completely on that. If they qualify financially, though, that's a PAP product. So anyway, I think you got the idea. Instead of going and putting these things around in truck stops, which are easy, no threat, go be a hero to the people in these disease support groups. Again, the discount card at the drugstore may or may not help them. But opening the door to what we can do for them at Lone Star by them calling that number down in the bottom right-hand corner, that could be life-changing. And there's not a lot of people doing what I just suggested to you of having a conversation with these support people. Go the United way. They have people who struggle with medications all the time. So anyway, if I were going to do this tomorrow in Savannah, Georgia, which is where I live, I would be looking up all of those disease support groups, and I'd be looking for them. They're all matter of fact, they're always happy to see you. The other opportunities that you probably have already thought about. Churches are great places to give these things away. Because there's always somebody in a faith-based organization that have a need, and if you don't know about your senior citizens facilities in your area, they're in every county. There'll be a group of a location or bunch of them where seniors get together. Seniors can be your best friend if you can get them working. I'm pretty close to a senior, so I can say this. They like to talk, and you want them talking about you. If you can get them talking about you being their hero of how you saved them a bunch of money on their Lanta Solastar, that word will pass through that community very quick. And a great way to begin the conversation is just walk in the door, meet the director, tell them who you are, tell them why you're different. Yeah, I know, other gals have been in here before with cards, but here's why we're different. And they'll engage a conversation with you that can be very profitable for you. Now, I'm going to close my PowerPoint. I'm going to try to open back up because you already know I'm still getting used to this new Join Me thing, and see if I can get the chat box open and see if I can, with my blind eyes. Well, you guys have been talking a lot while I've been working, but there's a lot of great ideas in there. It looks like there's a lot of people were talking about options. If you got a question, I can now see. So if you got a question that you'd like me to try to answer for you and the group, chunk it into the chat box, and I'll try to answer it for you. Somebody said they just got the audio back. Does anybody have an average who has handed out 10,000 cards? There's not a. Now I'm going to go way out on a limb of this, and if Chris or Dave here, they'll get mad at me. I guarantee you, there's not a soul that works for Lone Star agents that are Lone Star agents that have given out 10,000 cards. How about that? So the first one of you to do it, I'll have you on the webinar, and you can talk and you can tell us the results. Does it work with Medicare Part D, or they use the card off the Part D plan? Somebody asked me what's the cost of the card, and I should know that, but I don't. If you look at www.lstraining.net, over on the discount card section, go down to the bottom, it'll tell you how to order the cards. Or if you go to any of the other sections and look at the marketing materials, it'll tell you how to order them and what they cost. I think they're like $39, but I'm not sure. I should know that, but I don't. Well, there you go. Somebody posted it for me. Thank you. It's $2,500 for $39.95. Do we have a pharmacy in America? I don't know the answer to that either, but whoever asked that question, if you email me, I will find out for you. But that's an interesting question. Somebody way up there asked about how this works with Part D, and the answer is it depends. If they're not in the donut hole, it's probably not a true discount card's probably not going to help them. If they're not in the donut hole, but still paying a lot of money out of pocket for their generic medications or even brand names sometimes because they're off a formulary, the conversation with our advocate to see if we can qualify them for a PAP plan or the Select RX plan is very, very valuable. And in that case, they would use our program in lieu of the Part D. Part D cards are not as valuable to a senior today than they were a couple years ago, because the copays have really shifted up. Generics they paid $5 or $10 for last year are now $35, $45, $50 a month. And oftentimes our Flex card, which is in the Select RX program, can beat their copays. But if they go in the donut hole, we could very well be heroes to them because that medication is very expensive. Can the card be used all over the country? The answer is yes. In senior facilities, what if client has a power of attorney? Can we help them? Or I'm not sure what you mean by power of attorney. If they have a limited medical power of attorney, sure, we can help them. But there may be more of that question than I can understand in the text. But you guys know how to email me. The donut hole somebody asked is yes. Chris has given an override on the $1.75. Um, Somebody answered the question. There's a lot of cards out there you can't answer about the average. That's probably true. But if you can't listen, you can't just ride down the highway or go to the mall and throw these things all over the mall and think you distributed 1,000 cards. I mean, you could, but what you want to do is try to use those cards in having a conversation with people who can then become your salesperson when you're not there. That's the trick. All right, we're going to ask a few more and I'm quit. When do we get your script counts? I'm assuming you mean when do you know whether you've got any prescriptions adjudicated. We do that. Chris has set the schedule. It's in the book. We try to do it sometime toward the end of the month. But I can tell you, guys, y'all ain't passing out cards. All right. Let's see. All right. I guess I'm going to call it for the evening, because I've tried to keep this thing close to 30 minutes. But let me just close by saying this. I believe that the tools Lone Star have put in your hands to pass these things out and let them be silent salespeople is just a spectacular thing. You can. I mean, there are agents that have conversations with people all day long, but most of us, are more reticent to do that, and so if you go and work the card program, finding you a few key people who become your kind of friend in these high traffic places. Again, I would go to the disease support groups tomorrow. They'd be happy to see you. They'd be happy to talk to you. There will be people, if you ask, or are there people that come and are part of your group struggling to pay for their prescriptions? They will know. And so, I'd encourage you to really use this. Let me be crystal clear with you. I'm a straight shooting guy. The money to be made in this business is unique to our business, is unique to Lone Star. It will, if all you want to do is make money passing out discount cards, it will take you years and years and years of regularly dispensing cards to make a real income with that. That's just the truth. But if you catch the vision for what the cards can do for you of opening up this opportunity to one, help people, but two, help people and make a lot more commission with it by getting them to call our office, that's the power. Now, again, I'm going to try to do it. All right, well, I got to go. It was a great call tonight. Thank y'all for your time. You know how to get a hold of me. I'll be happy to talk with you any individually or email. I appreciate all that you do. And look, the world needs what you do. Let's go help them out and make some money at it ourselves. Y'all have a good evening. Thanks. Talk next time. I'll be up next Tuesday, 8 o'clock. Bye-bye.